Hi, my name is Dr.Shonkwiler, and I'm an oncology nurse practitioner. CDK4/6 inhibitors are a very exciting class of medications that have just been around since about 2015. They are mainly composed of three different medicines right now: palbociclib, ribociclib, and abemaciclib. CDK actually stands for cyclin-dependent kinase. That's just a fancy science term for an enzyme that's actually used for cell division and obviously specifically to the cancer cells. This inhibitor stops or interrupts the signal for cancer cells to grow. So that's how it works. This is mainly being used in patients with breast cancer, and specifically patients that are hormone receptor positive or estrogen and progesterone sensitive, and HER2 or human epidermal receptor 2 negative breast cancer. It's being looked at in trials for other cancers, but breast cancer is its primary use currently. These are a class of pills. So the nice thing is that you get to take these at home. They're often paired with other hormonal therapy for breast cancer, such as pills or intramuscular injections. Having them as pills means that you're responsible for taking them at home. How they're taken is actually specific to which pills that you're on. The palbociclib and the ribociclib are both taken daily. And they are taken for 3 weeks in a row, and then you get to take a week off, and then you repeat that cycle. The abemaciclib is actually taken twice a day and is taken continuously without a treatment break. So that's very specific based on which pill that you're on. These are taken with or without food. So just based on your convenience, they are swallowed whole. So you don't want to cut them up. You don't want to crush them. You don't want to chew them up in your mouth. You do want to make sure that you're taking them exactly as prescribed. Obviously, that's very important to minimize side effects and to make sure they're doing the best job possible against the cancer. So knowing how to remind yourself to take them on time can be done in a variety of ways. Some people will use technology. We have apps on our phones. People set alarms on their phones. There's even some apps that will send you a text message at the time that your medicine is due to help you remind to take it on time. Other people use more traditional forms. They'll mark it on a calendar. They'll just write it down on a pill tracker form. Any of that is acceptable. The key part is just that you remember to take it as prescribed. If you do miss a dose, that can happen. If it's within a few hours, it's okay to take the medication. If it's been longer than that, it's probably just best to wait to the next day. You're never going to take 2 medications at the same time. Now I'd like to talk to you for a couple of minutes about the possible side effects. One thing I do want you to expect is to be having labs drawn on a regular basis. You'll have labs drawn before you start these new pills, and you'll also usually have them drawn every couple of weeks for usually the first couple of months of treatment. That's because we really want to monitor how your body is doing, how your blood counts are doing, how your liver and kidneys are doing and handling this new medication. One of the most common side effects across all of these pills are simply to bring down your white blood cells. We know white blood cells are what help fight infection in our body, but we need to be sure that we are preventing infection as much as possible. So things that you can do that are important would be to wash your hands and stay away from sick people, to really pay attention to your body and make sure you're not getting any signs of infection. If you're getting fever, shaking chills, anything that makes you feel like you're getting an infection, that would be a very important thing to let your cancer team know as soon as possible. We're going to watch that on blood work, and that is something that's very common that we watch for. Tiredness is unfortunately a very common side effect of many of our cancer treatments, but CDK4/6 inhibitors are one of those as well. So you're going to really want to pay attention to your tiredness level. Give yourself the opportunity to take breaks if you need it. It's also really important to actually get some regular activity in your everyday, simply because that really helps decrease the fatigue. Feeling sick to your stomach or nauseous is also sometimes a side effect that's seen with these pills. Your cancer team will probably be prescribing a medicine for you to have at home to take if you need it. As well, if you feel nauseated, just using small, frequent meals might be helpful. Cold foods sometimes are helpful. Also really important just to help keep yourself hydrated. Another side effect that's more specific to the abemaciclib is for you to have some diarrhea or some liquid stool. That is fairly common with the abemaciclib. Thankfully, it's more common in the first month or two, and then it tends to get better. It is really important during those times to make sure that you're keeping yourself hydrated. If you get dehydrated, you will really start to not feel as good. You can also use over-the-counter anti-diarrhea medicines such as loperamide. Also, you may want to make some changes to your diet. There are certain things that tend to irritate or worsen diarrhea, such as caffeine, dairy products, raw vegetables, things like that. Another thing that we mainly check on lab work is your liver function. Your liver is what processes these pills, and we want to make sure that it's not feeling stress. So that's something, again, that we'll be watching on blood work. Other blood cells can be affected by CDK4/6 inhibitors. Specifically, your red blood cells can come down. That we say that means you may be getting anemic. Red blood cells are what carry oxygen in your blood. Also, platelets are what helps clot your blood. Those cells can also come down. So things you're going to want to monitor for are feeling more tired from becoming anemic, or also just watching for any easy bruising or any bleeding issues that can come from your platelets being low. Sometimes your mouth also can get sore when you're on these medicines. That's not very common, but it's possible. Again, you want to be careful to not put things into your mouth that might irritate any soreness. Things like tobacco products, alcohol, spicy foods, acidic foods, all of those can sometimes irritate your mouth if it's already sore. Trying to get foods that are really soft and easy to swallow also is usually much easier for you if your mouth does have some soreness. These pills also sometimes can cause a little bit of hair thinning. So it's not hair loss. You're not going to lose all of your hair, but you may have some thinning of your hair, something that probably you would notice, but the average person who knows you wouldn't. Another thing that we're going to watch on blood work is actually your kidney function. We want to make sure that your kidneys that process toxins in your body are doing well. The abemaciclib specifically can bother the kidneys a little bit. It can decrease the kidney function just a little bit, but generally it's not very clinically significant. But again, it's something your cancer team's going to watch closely on lab work. Ribociclib also has a very low risk for causing a change in your heart rhythm. So you may have something called an EKG or an ECG, which stands for an electrocardiogram, which is basically where they put the little stickers on your chest and take a little snapshot of what your heart rhythm looks like. That may be monitored, more regularly when you're on the ribociclib. In general, people do really well with these medicines. They find that balance of it being helpful against their cancer, but also livable. Having a good quality of life is obviously very important to you, but very important to us as part of your cancer team as well. If you're having significant side effects, things that could happen are we may tell you to hold your pill for a little while, just until you're feeling better. Then your cancer team will evaluate whether you may need an actual dose decrease of your pill. Now, sometimes that brings a little bit of nervousness. People don't want to reduce the dose of their pill. But what I really want you to know is that the point of this medicine is for you to be on it for a long time. So we need to personalize this. We need to individualize this to your body. And so it is not an uncommon thing that sometimes we have to bring the dose down a little bit so that you can continue to take this medicine well for as long as you need it.